everyone. Hello, everyone. Welcome to the first HIV Cure webinar here at GNP Plus. The HIV Cure Desk is very new, and so today we are starting in, I think, very hot because Professor Tumbi has been trending this year, so it is slightly hot. So this session will introduce the HIV Cure Desk at GNP Plus, connect PLHIV leaders and communities with the latest cure science and what researches are happening regionally as well, and also look at the community perspectives and also the role that community engagement plays at in the HIV cure research. So my name is Doreen Morata. I have realized I did not say my name, and I lead the HIV cure desk at GNP Plus. And here I want to hand it over to Florence to give us just a slight introduction on why HIV cure conversation matters and the whole initiative, why it started, and just the vision about it. And then I can introduce my panelists afterwards. Flo, please take over.
I have to echo your excitement, Doreen, that this is happening at GNP Plus, the Global Network of People Living with HIV. Everyone, it's a true joy to be able to be here with you and to sort of set the scene for this historic, fast GNP Plus People Living with HIV-led advocacy on HIV cure. At GNP Plus, if you've followed us this year in social media or engaged with us, you have seen that together with my co-executive directors, Bongile and Kosi, we have been very intentional to motivate a liberated movement of people living with HIV who understand who we must be now more than ever. We must be the leaders. The period we are in is significantly shifting. There is so many changes, but at the heart of the HIV response lies people living with HIV. We are the leaders, and now more than ever, we must step up. For very long, the story of HIV for people living with HIV, particularly if you were diagnosed 10, 20 years ago, like some of us who are now probably sharing how old we are, it began with fear and always ended with the grave. Thanks to researchers, donors, our governments, partners, this story has changed significantly with the biomedical progress of HIV science. The current HIV treatment story is that of significant excitement. If a person living with HIV is on treatment and virally suppressed, then we not only have long quality lives, we cannot pass this virus, hence driving down HIV infections. U equals U shows the power of treatment as prevention, which continues to revolutionize both the investment and discoveries for treatment and prevention, and is heading us onto the path for long-acting treatment and better optimized treatment. But for now, an opportunity for an even better story, one that is optimistic and hopeful, is here with us. A story that does not end with people dying from AIDS, but living because of cure. A story where the next generation never knows what being positive meant as a life sentence. A story where we grow old, fall in love, raise children, chase our dreams. A story of freedom. Our colleagues joining us today from AVAC, from the Africa Cure Consortia, from everywhere else, thank you for agreeing to collaborate with us. We are excited to join the work on HIV cure, which has progressed and of course engaged with a lot of other people living with HIV, but coming together formally like this significantly moves the work better for all of us. Thank you for leading us on the call today. We certainly hope this is first of many opportunities of collaboration moving forward. To the people living with HIV on this call, your lives are the reason we are here, is what motivates us to do this leadership from GNP Plus. I hope your voice is included in all the knowledge we have to gather, the science and the research we must do so that our voices collectively can finish this story with the optimism and the hope it offers. Thank you, and back to you, Doreen.
Thank you so much, Florence, for echoing very important sentiments that at the end of the day, our story does not end in death. Our story ends with a cure. And at the end of it all, we are the recipients of the cure. So we must be at the center stage of the conversation of the HIV cure. And today I am joined here by very amazing panelists who have worked in the HIV cure space in research, in advocacy, and I want to hear from them and I want them to just introduce themselves to us very briefly, and then we can now start unpacking the HIV cure. I want to remind all of us joining that there is French translation. So just click down there on the French translation tab, and then you can be able to access the session in French. So I'm going to start with Elena, because you're the community advocate. Could you please just introduce yourself a little bit? I know I have your bio, but I want the people to hear what you have to say. Oh, Elena has gone. Okay. Jessica, let me come to you as I wait for Elena.
Hi, I'm Jessica Salzwedel. I'm a senior program manager at AVAC, and I lead 3 of the 10 Martin Delaney Collaboratories community engagement program. I've been really focused on bringing community stakeholders within the cure research process. I'm also part of the Africa HIV Research Cure Consortia. So I'm just really excited to be part of this conversation today.
Thank you so much, Jess. And Professor Tumbi, please introduce yourself to us briefly.
Thank you, Doreen. My name is Tombe Dongo. I am Director for Basic and Translational Science at the Africa Health Research Institute in Durban, South Africa. I am also a professor at the University of KwaZulu-Natal. And at the moment, I'm also leading a network called SANTE, which is Sub-Saharan African Network for TB and HIV Research Excellence, where we do HIV and TB research. And I'm also involved in the Africa HIV Cure Consortium.
Thank you so much, Tumbi. You forgot to tell us that this year you have been a celebrity. You've been trending.
We will get back to that.
And Marcel, please introduce yourself.
Hi, so this is Marcel Tongo. I'm from Cameroon. Bonjour les francophones. So I'm a medical biologist by training. So I'm working on HIV, mostly like from the lab perspective. I'm the head of fundamental biology lab here in my institution, which is called Center for Research on Emerging and Re-emerging Diseases. And I'm also like the country PIs of the Santé that Tumbi the consortium that Tumbi is leading. Yeah, really nice to be part of this webinar.
Thank you so much, Marcel, and thank you for joining us today. And now, last but not least, Elena, please introduce yourself briefly.
All right, thank you very much. Hello, everyone. My name is Erina Mosinga. I'm an advocate for HIV Cure. I represent the voices of the communities, and I'm also part of the PLHIV Collaboratory, and I'm also alumni of the HIV Cure Academy. Thank you.
Thank you so much, Elena. And now we are going to start on the questions. I'm going to start with Elena, but this question is for all of you. Elena, in one sentence, what does a HIV cure mean to you from your perspective, especially from a community-focused perspective?
All right, thank you very much. So in a sentence, cure would be another level of achievement and freedom for all people living with HIV to live at their own terms and not defined by pills and the struggle of remembering to take medication daily. So briefly, I'll define it like that. Thank you.
Professor Tumbi, to you as a scientist and a researcher, what does a HIV cure mean to you?
Yeah, sorry. I would also, for me, an HIV cure would be if you are able to completely eliminate HIV from the body, from people who are living with HIV. That's definitely the the ultimate goal, and that's what I would like to see.
Mhm. Before I go to Jess, let me go to Marcel first. Marcel, what does a HIV cure mean to you as a person living, as a person working to find the HIV cure?
Yeah, for me, HIV cure just means we get we just get rid of HIV. We have so many diseases, in our country, and then we don't have all the means to fight
Mm-hmm.
to fight against all these diseases. So we for me, HIV cure just means we have at least one disease that we will not talk about anymore, and then we focus on other major diseases that are that are really killing our people, killing our community.
Okay. Thank you so much, Marcel. And lastly, Jess, to
You
you,
know,
you've
I
interacted with both of us, the community world, the research world. What does a cure
yeah.
mean for you?
I asked my son this question last night and thinking about all of these, and he said, I think it means healing. And I really resonated with that because I think he meant physically. But what
Mhm.
I think about cure is that it really does heal on both an emotional level. I think it heals on a lot of stigma. I think that there is a lot of healing that our communities need to do. And so really what cure can bring is this idea of healing. And so I thought that was sort of the perfect sentence definition of why we do this work.
Yeah, I like that. It means healing, the holistic aspect of all of it all. And yeah, I think I like that. And I'm just asking the people who are joining us today what to let us know what a HIV cure means to them in their own words. So I'm gonna hear from them in a few minutes. But I'm gonna go to Professor Tumbi. The first question starts with you. Um, can you explain to us the difference between a functional cure and a sterilizing cure in simple terms for PLHIV communities hearing about this for the first time?
Okay. I think we have to start, Doreen, with the fact that we have very good antiretroviral drugs, as Florence pointed out. And these drugs can control HIV to undetectable levels. And this allows people living with HIV to live healthy lives. And they cannot also pass on the virus to somebody else if they're taking antiretroviral drugs. The challenge we have is that these drugs, although they're very good for improving the quality of life, they don't eliminate HIV completely from the body. And what happens is that if you stop taking antiretroviral drugs, within 2 to 3 weeks, the virus will come back. And of course, that is not very good. So scientists are thinking of two ways to really deal with this problem of HIV in the long term. One would be to completely get rid of HIV in the body. So that's a classical cure. So you look for the virus in the body and you can't really find it. So that would be a cure. But there is another way to look at the issue, and that is the fact that people have to take antiretroviral medication every day, every single day, for the rest of their lives can also be very challenging. So the other way to think about a cure or a functional cure is to think about being able to control the virus at undetectable levels below the levels of detection, just like somebody who is taking antiretroviral drugs, but without antiretroviral medication. So that's what we call a functional cure. So I think those two are the goals of HIV cure research, and they are both, in my view, they are both very laudable goals. If we can achieve one of those things, I think we would be making a huge, huge progress. Either we completely get rid of HIV from the body, that's a sterilizing cure, although now we don't like to use the word sterilizing cure because it confuses people. We like to just call it cure, a classical cure. Or the other one would be control of HIV. So the HIV is not completely gone from the body, but you can control it without antiretroviral medication. So that's what we call a functional cure or a control of HIV without antiretroviral therapy.
So being undetectable for a very long time without
being undetectable, but you're not taking antiretroviral medication. Yes.
Okay, thank you so much, Prof. And I want to now go to Marcel. And my question to you is, what recent breakthroughs have reshaped how scientists think about the possibility of a HIV cure? Marcel, you're muted.
Yeah. Thank you, Mohan. And I think there's really a hope based on the recent finding from the field. I just want to mention a few of them and start with what most people now call based on patient that this was found. You know, many people knows about the Berlin patient, the Geneva patient, the San Francisco one. Yeah. So basically, in this number of individuals, they had like some blood problems, and then they have to transplant an organ into their body to make new blood, and then it was found that in those small individuals, the organ that was transplanted harbor some like produce blood with cells that harbor some mutation. So those mutation makes those their cell non-susceptible to HIV infection. So much so that the HIV which is inside those patients will not infect the new cell that are produced until they are died. You know, so those patients were found to be free of HIV after certain time. So while this is not a scalable solution for the general population due to the high risk involved, these cases provide at least proof of concept that a cure is achievable. So I also want to mention like something which is like which might be can be an application of this first case is what we call gene editing, so that scientists can go to our DNA to modify our DNA so that our cell and make our cells like no more susceptible to HIV to HIV infection. This is also one breakthrough that makes that HIV cure is possible. You also have mRNA transfer technology. You know, this mRNA technology came during the COVID period, and it's also possible to apply them in a cure field, whereby you can infuse the RNA that produce lipid nanoparticles, which can help like get rid of cells that are targeted by HIV. And then you also have like a molecule like body neutralizing antibody that people use. And don't forget that there are some trials, what we call whereby we interrupt treatment and then we give some of this molecule to participants. Although we haven't heard any very good data, very good news about those trials, but at least there are some participants who remain with no treatment by just receiving this molecule. So these are some promising news that it's possible to achieve cure, but we are just at the beginning. we need to continue working on that. We need collaboration. We need more funds, and then we also need to engage, like to take all the intervenants on board.
Mm-hmm. Thank you so much, Marcel, and thank you for highlighting that there are people who've been cured of HIV, but they were not cured because they walked into the hospital to get cured of HIV. They were cured based on the fact that they had cancer and other procedures had to be done on them. And thank you for highlighting that those procedures are not feasible to the rest of the 40 million people, but they give us hope, especially with the first patient that was cured, the Berlin patient, Timothy Ray Brown. He was cured and he gave us that hope that we can actually cure HIV. So thank you so much for highlighting what is currently being done, and also for saying that we need money. We need the money, and also because the cure is going to save us money from putting people on treatment for the rest of your lives. So there is that. Yes, yes, we are going to save money once we are cured, then the money that goes to buy us treatment. It's a win-win situation. Anyway, Jessica, I'm going to come to you. And this question is, which current HIV cure strategies, Marcel has mentioned some of them, do you think hold the most promise today?
Yeah, I mean, for me, anything immune-based. And I think it's really because we have the evidence to say that. And I think we know that from elite controllers, and post-treatment controllers. So elite controllers being individuals who are able to keep their virus suppressed without antiretrovirals. Post-treatment controllers, so they've gone through some clinical trial or they've taken their medication and for some reason had to stop, most often within the context of a clinical trial, and they are able to control without, again, medication for some period of time. And then we have a growing number of broadly neutralizing antibody trials that have shown some control or this idea of a functional cure. Yeah. And so for me, these immune-based approaches seem to be both really exciting and we have the evidence to back it up.
Yeah.
But just to say, I think when we think about strategies, there's almost two buckets. There's those that target the person living with HIV to enhance their immune system or to give them immune-based products. And there's strategies that target the virus itself. And so we're going after trying to replicate Timothy Ray Brown by altering or picking out the virus or making it so that it's ineffective and it can't replicate. So there's those two main buckets.
For some reason, I don't know why I've gotten lost after Timothy Ray Brown. I am really a fan of Timothy Ray Brown, by the way, because he was the first person that introduced me to the reality of a cure after I had gone down a whole rabbit hole of trying to find a HIV cure. So yeah, I am a very huge fan of him. May he continue resting well. Elena, I am going to come to you. From the community perspective, what does HIV cure mean to people living with HIV? And why is it important? I know you said what it means to us, but why is it important that communities understand this now?
All right, thank you. I think it's very interesting because when defining cure, and I was also looking at the chat box, we've got different definitions, but most of the time for the communities of people living with HIV, you see how the definition extends to the personal stories, the experiences of facing the stigma, the burden of the pill burden. So by the end of the day, it's about visualizing what life would be without all that. No more stigma, no anxiety, hope, and just that freedom for the future. That's how a lot of communities define cure. So I think right now, talking about Timothy Ray Brown, we've seen a lot of successes in cure research. So cure research is no longer a distant idea. It's more real with the evolving scientific journeys. I think now it's when we're also deepening it. It's also important that communities get engaged. We need to make sure that they're informed and involved area as well. We have to shape the priorities. What kind of priorities do we need to engage for the communities of people living with HIV? What kind of benefits are they going to get as we're waiting for the actual cure, but the cure research itself, how can they benefit from all those processes? And I know also in terms of looking at the regions with the high burden, how best can they feel that they're part of the processes? So the voice of the community today needs to determine how inclusive, ethical, as well as accessible the cure is going to look like tomorrow. So it is very, very important to make sure that the communities are speaking up and are also fully engaged and are effective in that engagement. Thank you.
Thank you so much, Elena, for highlighting the fact that we have to start the conversation now, because I was in a meeting about sickle cell and HIV, on how to work around gene editing to get a HIV cure and a cure for sickle cell as well. And one of the things that was brought out was the inequalities that of how long it took before we could get ARVs in Africa, and yet we hold the huge burden. So thank you for insisting that as communities, we need to know what is going on. We need to understand, because at the end of the day, when the cure is finally found, it is us who are going to be the recipients of the cure. Marcel, I want to come to you and ask the work that you're doing regionally. What can you walk us through the HIV cure research currently happening in the larger West African region and even Cameroon? Are there any trials or collaborations that are shaping the region's approach towards finding a HIV cure?
Okay, thanks, Mohan, again. HIV cure study is just at the beginning here in our area, but we have some preliminary contributions within Central West Africa, notably from Cameroon, and then just highlight some potential. Let me just names and few studies that have been that were done or that have been doing here in Cameroon. So they are mostly like lab-based work. This include, for example, quantified the HIV reservoir. We have something special here in West Central Africa. Contrary to what we are experiencing elsewhere in the world, for example, in the Western world, where one type of HIV is circulating, the same situation is also observed in the whole Southern Africa. Here in our region, we have many different HIV types, HIV lineages, HIV variants that are circulating. So we need to understand if the reservoir is the virus that hides into our cells, despite even if we have a suppressive situation. So we still need to know if that reservoir is the same across all the different types of the viruses that we have here in our region. So some study have been doing in that direction. You also have the study that are carrying out here to understand the biology of the different of those different viruses. If when confronted with the different strategy, they will behave the same, or if we need like a kind of combination to achieve a really efficient cure here in our region. So this biological study, yes, I'll be doing to see if actually those lineages behave differently when they're confronted with different solutions. So in terms of clinical trials, as far as I know, there's only one which is even multicentric, whereby the Cameroon is part of like a bunch of countries in Africa, and whereby they are testing which antibody will be efficient for a cure strategy in the whole Africa region. So as far as I know, this is the only trial that is going out. It's about to start, and then it's going to involve one team here in Cameroon. That will also that might be if results are positive, that we might extrapolate the finding to the larger region. Yeah, I think that's what I can say.
Okay, thank you so much, Marcel, and for highlighting that there is already work that is gonna start in Cameroon, that has started in a small scale and moving to a larger scale. Because on many times when we speak about research, it is really from the global north. We we end up feeling like we are being left behind. So thank you for highlighting that. And as we highlight research currently ongoing, I'm gonna go to Professor Tumbi and ask, what does the cure research landscape look like in the East and Southern Africa region? We've heard what Marcel has said, and which innovations or trials stand out, and what is making these regions unique in the global effort?
Thanks, Doreen. I really like what Marcel has said, and I think it was Elena before that about communities being involved and being part of this, because it's really, really crucial. So I think that in the past we have tended to wait on the West for innovations.
Yeah.
We the antiretroviral drugs that we use in Africa, most of them were developed in the West, in resource-rich countries.
Yeah.
Now we know from COVID and that we cannot rely on the West. In fact, we know from what is happening even with HIV now,
Yeah.
that the Western countries are not always reliable, are not going to always be reliable partners. It depends sometimes on who is in charge and that kind of thing. So we need to be very careful about being over-dependent on other countries.
Yeah.
And therefore, we need to have our own research programs, right from understanding disease to innovation and developing our own medication that can be used by anybody, anywhere in the world. But that comes with investments. We have to invest in research. And if we don't invest, we will always be dependent on others. So in terms of, just to come back to your question about what is the landscape of research on HIV cure in East and Central Africa, I think there's a lot of work that is going on. Some of it is on basic, what we call discovery research. It's understanding the reservoir itself. The reservoir is the virus that hides within immune cells. And that's what we are trying to eliminate when we talk about an HIV cure. So we need to understand that reservoir. We need to study people who are living with HIV so that we can understand where is the HIV hiding, how does that virus look like when it is inside the immune cells. And that requires a lot of laboratory work to understand that. So that kind of work is ongoing. It's at a relatively small scale, but it's very important work, because it's what can lead us to discover the medications that can help us to get rid of HIV. The other kind of work that is ongoing is what I would call clinical research, clinical trials. So in order for us to say that something can actually work, it has to be tested in people. And so there's a lot of clinical trial work that is ongoing. And the study that we did, for example, here in South Africa, among young women who are living with HIV, to try and see whether you could give broadly neutralizing antibodies, and whether if we interrupted treatment, if we stopped treatment, would that result in long-term control. That's clinical research. And again, we should not be waiting and waiting for others to do this kind of work elsewhere. We must be at the forefront of this work, because if we are not at the forefront, the products, if they are developed, they will take much longer to get to the population. So it's really, really important that that kind of work is done. And then finally, I would also like to emphasize socio-behavioral research work, and as well as research on policy do we have the right policies and regulatory framework? What should we be doing in order to enhance this kind of research and to make the research ecosystems in Africa suitable for this kind of work? Yeah. Do our communities understand what HIV cure is? We recently did a study in Umkanyakunde district here in KwaZulu-Natal, and what you realize from that research is that there's very limited understanding. People don't understand. There's a lot of confusion and misinformation about HIV cure research. And when there is misinformation and lack of information, it makes it very hard to do this research, because people will come with all kinds of conspiracy theories. Yeah. Some people think that their blood is being taken so that it can be sold, those kind of things. So people need to understand what is going on, and they need to be part of the research and inform the research, so that communities and researchers and even drug developers, everybody is working together towards a common goal. But there has to be a trust that is built. So in summary, this kind of work is going on, and I'm very proud of the work that we did here in KwaZulu-Natal, because it's pioneering work. It's the first time that this kind of work has been done in Africa. But I hope, and it was a very small study, 20 people. This kind of work has now started in other places here in South Africa. I know some of this kind of work that is going on in children, in adults, elsewhere. But we need much more. We need much more if we are going to make quick progress. And we cannot wait for others to tell us what to do. We must take the lead in terms of developing the initiative, because we have the capability, we have the science to be able to engage this problem, because it is indeed a solvable problem.
And thank you so much for highlighting the work that is being done in East and Southern Africa, and for insisting that policies must be in place. Money has to be put in place, because money is very important.
Absolutely.
And that we can actually, as Africa, lead the HIV cure research. And now I'm going to go to Jess to just give us a little bit on the global perspective of research. I know Prof mentioned earlier that most of the times the research comes from well-resourced countries. Could you please just tell us what are some of the key developments happening globally, and how do they intersect now with the work that is happening in Africa?
Yeah, big question, but I think that there's a number of things going on, and so I'm not going to highlight everything, but I thought to just highlight perhaps a few key pieces. In Brazil, in South America, is a place that we don't often talk about. The Transcendento cohort is really leading the way, and it's a cohort of trans women, both living with HIV and without. And I think how that really begins to intersect when it comes to cure work is how we look at exogenous hormones, or hormones that are introduced from outside of the body. And that's not just with trans individuals, but women going through menopause and things like that. So really how we are beginning to shape how those impact and affect our cure approaches to cure is something to really look at, and leading the way there. Thailand has also a fantastic cohort that is really a model for thinking about how we look at early therapy and how that might impact cure research moving forward. And the two pieces that really intersect there are also that there are diversity of clades, right? So it's not just one clade, and Marcel really touched upon this, and what's happening in their lead in Cameroon is really looking at the diversity of HIV. And so thinking about these two different clades and how we can begin to learn from the testing and adapt that in new settings. And Professor Thumbi mentioned this, but Africa is a powerhouse when it comes to pediatric research and perinatal HIV cure, and is really the trailblazers leading the way from Botswana to South Africa to Cameroon. The cohorts that are established on the continent, the research that is pioneering on all fronts from tissue research is just something to be applauded and astounded, and is really paving the new way that when we think about the pediatric landscape, it is P1115 that influenced cure, but which is a clinical trial that started individuals on therapy early to mimic what is the Mississippi child, but actually changed the way treatment landscape, the pediatric treatment landscape is. And so how cure the research can influence policy has played out in the last decade in the pediatric landscape, and I think can be a model for how we think about adult treatment and and cure research moving forward. So just to say that is a really pioneering and leading the way. But as far as the global landscape, I think the other piece that you asked me to look at was how it all intersects with Africa. And I think there is a move to realize that, Africa has so many questions and amazing scientists that really can lead the way and ask their own research questions and do the work, which is what both Prof. Thumbi and Prof. Tango have said. And so I think, there has been also an investment to think about how places like the US and Europe can really work with African scientists and invest in research and technology there so that they can ask the questions and we can just benefit from their amazing work and knowledge and adapt it in our setting. So I think that's something that's also happening.
Yeah. Thank you so much, Jess, and for highlighting that there's work going on globally that I actually did not know about the Brazil and Thailand cohorts at all. So thank you for bringing that up. And to everybody who's joined us, we are having the very first HIV Cure webinar. And if you have questions, I can see that there are some questions in the Q&A chat. Please ask them. So far, we've discussed about the research happening globally and in the African region as well. And we have also unpacked what a cure means for us. And we have just gotten to know some of the cure strategies that are being researched on currently. And now I want to go to a part that Professor Thumbi did mention about on ethics, trust, and safety. But I'm going to start with Elena. Elena, from your perspective, what ethical or trust issues do communities raise about participating in HIV cure research?
Sorry, I think I had a network glitch. Can you just come over the question? Sorry.
The question is, from your perspective, what ethical and trust issues do communities raise about participating in HIV cure research?
Okay, thank you very much. So I think the key number of things that really come up. So we're talking about how many feel about the scientific information being too technical. I think that has been a lot of also discussion in terms of how do we simplify the science into a consumer-friendly for the community. And there's also a lot of wrangling mistrust rooted in historical experiences where research felt like it's externally driven or lack transparency. It also goes back to the same idea of maybe not fully understanding what the technical terms really mean. The issue of safety really comes up a lot, of course, especially around analytical treatment interruption. For a long time, we have been advocating for U is equal to U, encouraging communities to stay on the medication. Now, all of a sudden, we're talking about stay off your medication, get engaged in your research. So there's always issues about safety, risk of rebound. In majority, that is the main cause of worry. So, and also many people fear of unintended disclosure of the HIV statuses, because I think by end of the day, it's not just research for the client engaged in the study, but it's also about their partners as well. So how best can they also protect their partners, and also issues around stigma and discrimination and relationship challenges also come into play. And also communities do question what support or access they will get after the trial. And also comes in the fears of they were really looking forward to a breakthrough. Maybe it might have happened on them, but maybe they rebounded and they can no longer be part of the trial. The question is what next is going to be there for us. And finally, also the issue of trust is usually weakened between the community voices as well as the researchers. So I think also it would be imperative to ensure that we're also strengthening the CABs, and also that civil societies are meaningfully engaged to at least just try to reduce the different impacts around ethics and safety. yeah, I think that's what I can share at this point. Thank you.
Thank you so much for sharing that, Elena. And it is very comprehensive because the community does have questions. And what next? The trust. We have worked so hard on you equals you, and you now want to take me off my treatment and stuff like that. So thank you so much for highlighting that so beautifully. And uh, Professor Tumbi, I also want to ask you what are some of the ethical considerations, especially in African contexts, particularly where stigma, misinformation, or limited resources exist. And you did allude to this a little bit earlier.
Yeah, I think that Elena has really summarized it very nicely, but I think there are certain points that I would like to emphasize. First of all, you cannot do research successfully in a community if people don't understand what is being done. And so education is very, very key. And for me, education is an ethical issue. If we don't educate communities about what is being done, and it doesn't matter how good a cure drug is. If people don't understand it, there is going to be misinformation, and there is going to be misunderstanding, and that will have negative consequences because people will not be able to use that product. So I think the first thing is that communities need to be educated about what is going on in the area of HIV cure research so that they fully understand. And then the second issue is that when we actually come to do the trials themselves, these trials are not risk-free. These trials come with some costs. Sometimes the drugs that are being tested, the full safety profile is not known. And that's true with any new drug. So we need to be careful that people understand, but that there are some risks sometimes, and it needs to be explained. That's why I think having a strong community advisory board is really important so that people understand when these studies are done in a particular community, they understand what is going to be done and what might be the risks. But in particular with HIV cure research, there is an added layer of risk because, as Alina has pointed out, you are asking people to stop antiretroviral therapy, which is very effective in itself. And we have also always told people, do not interrupt, do not stop your antiretroviral treatment. So communities, people get confused. Now you're telling us to stop treatment. But it's very important that people understand that we are not saying that anybody should stop treatment at home in order to see whether they're cured. These are clinical trials that are done under very controlled condition. And so you have to be part of a clinical trial, and you have to be very closely monitored within a specific study by clinicians who understand HIV very well, so that they can check you very closely to make sure that no harm, that you don't suffer any harm if you are participating in an HIV cure trial. So I'm not saying this to sort of scare people or to say that we shouldn't be doing this. Of course, I'm here because I'm an advocate for this kind of work.
Yeah.
But what I'm saying is that we need to work closely together so that the message comes across about what is being done. Why do we need to interrupt treatment? And under what circumstances should we interrupt treatment? So for me, education is very crucial. The issue of how the specific studies are communicated and what is done within those studies need to be addressed. And but at the end of the day, I want to emphasize that if we don't do these kinds of studies, we will never have a cure because we will never know whether something works or not. So it's very important that we balance. It's always a balance, that we balance the risk and try and minimize that risk. That's what ethics is all about, is you try and minimize the risk and maximize what knowledge we can gain from these studies. And I And that's why nobody has the answer 100%. That's why we need to work together.
Yeah.
As people living with HIV, as scientists, as advocates, we all need to work together to see what is that sweet spot of balancing all of these issues so that we move together rather than alone. There's that African saying, if you want to go far, go together. But you want to go fast, go alone. I feel that in this particular case, when it comes to HIV cure research, we have to make sure that we go far because we want to eventually get to a cure, and we must therefore do it together.
Mm. Thank you so much, Tumbi and Elena. The funny part is you have answered the questions that I wanted to ask Jessica and Marcel. So now I have to go to the next segment so that I can bring out the aspect of meaningful community engagement. And I see that the people who have questions, so let me try and balance out the time. And Jess, I'll start with you on meaningful community engagement because you've been involved with both worlds. From a research perspective, how can scientists ensure that people living with HIV are true partners in the work and not just participants? And I know Prof. Tumbi has alluded to a part of it, but I want you to just bring it out together.
Yeah, I mean, I think that this is sort of the most critical question. I think, researchers have done amazing work in the cure field, understanding that communities need to be central to these conversations very, very early before there's a product, while it is still at the bench and shaping the direction, because there is so many unknowns. Even what is cure? What is the goal? What are we trying to achieve? And so I think that with that in mind, communities can can get involved in a number of ways. One being a community advisory board, but even just thinking about talking to researchers about perspectives. Researchers are more than willing to open up their labs to understand what are the machinery, what's going on, and so that you can be that voice in your communities, whether it's at the soccer field, at the football field, or within your family's dinner table, to say, oh, this is what the virus looks like, and these are what scientists are doing to just engage in those conversations, to make these connections with individuals, and to have that dialogue and exchange about what your life looks like and how a cure would fit in. And I think the reality is, as we move forward, when we talk about something being controlling or complete eradication, there's a messy middle there. And Sante has done a great job with these analytic treatment interruption guidelines that will be coming out to think through what is the guidance around taking individuals off. Well, part of that guidance is thinking about, well, what is the number of virus and viral rebound that you can tolerate? And part of that is a community question. How do you feel comfortable? What number would you feel comfortable? And when we think about control, is it 50? Is it 20 copies? Or is it 100? And I think that those are the types of questions that researchers need to have exchanges with communities now, and are having those dialogues. And so communities can get involved in those places. And obviously serving on community advisory boards is just one entry point, I think, to a larger piece. And maybe what I will say as a plug is that, IAS and AVAC have an HIV Cure Academy for advocates, and where we try to bring in and do a crash course. And then that opens up a gateway to thinking about how do you engage in policy discussions, in bringing this to your local communities and translating it out. Doreen and Alina are both alumni of that academy. And so I think if this is something that's interesting to individuals, we would love to think about how do we bring more folks to that academy and train this next generation of folks to talk about it.
Thank you so much, Jess, for bringing this out, and also for, even I did not know much about a HIV cure. I did not know what BNABs were until now. So thank you, because you have actually opened the door for community advocates as well to be privy of the research going on, the information going on, and to even take that information back to the communities. And like Elena is doing great work in Malawi. And I am very proud of it. So yeah.
And maybe
And
just to follow up, that education is true, like Thumbi said, it is really an ethical issue. And it
yeah,
also is our responsibility to
mhm,
educate researchers on how to be better communicators.
yeah,
They learn one way to talk about it, and we talk about it in a different way. And so I think being able to be that bridge is really important.
true, true, 100%. I agree with you, Jess. Marcel, what are communities currently, where are communities currently excluded in West African research, and what needs to change to address this?
So I will talk instead of excluded. I will talk
Mm-hmm.
more about I will talk more about underrepresented. Yeah, community
Okay.
are really underrepresented, and these fall along lines of stigmatized identities, geographical isolation,
Mm-hmm.
socioeconomic status, and sometimes age. So let me develop some of these. For example, you have key population here, included men who have sex with men or female sex workers and people who inject drugs are systematically underrepresented. Why? We have to remind that this is primarily due to the criminalization of the activities and identities in most West Africa countries, leading to intense fear of stigma, discrimination, and violence from both community members and healthcare providers. You also have adolescents and young people, particularly street involved youth and those from sexual minorities. So they also face significant barriers, mostly because they would need parental consent. They also lack of youth-friendly services and in general a lack of understanding of research procedures. You also have like geographical isolation because research tends to concentrate in capital cities or in big cities or big or large urban centers, leaving rural communities with limited access to research opportunities and often basic HIV and services. You also have people with disabilities. So this group continue to be largely left behind, facing barrier in accessing information, testing, and care services, let alone research participation, which often lacks inclusive infrastructure for this kind of population. Or you also have a gender issue. You know, men in our setting, men in general are less likely than women to engage in HIV services across the care cascade due to factor maybe like stigma, perception that perception that facilities provide women-centered services and work schedule that conflict with their clinic hours.
Mm-hmm.
So what change can we envision to address exclusion? We need some tailor community engagement. Like we need to implement targeted, culturally sensitive engagement strategies such as the citizen science approach, which work elsewhere very well, and which will involve like community members, including traditional and religious leaders in the design and implementation of research. We need to address to face stigma and discrimination. Conduct awareness campaign to educate. To be talk about education. Just also talk about education. Yes, we need to conduct awareness campaign to educate the public about HIV prevention and treatment to reduce stigma and provide anti-bias training for healthcare providers to create welcoming and non-judgmental clinic environment. And also, we need to attack the key issue about legal and policy reform. So we need to advocate for changes in punitive laws that criminalize same-sex practices and sex work, as the legal environment is a major deterrent for this specific population, and maybe also improve accessibility and infrastructure. For example, we need to increase to increase the centralization of research and care service through our community-based intervention and mobile clinic. This is not in our culture, but we need to start thinking about that. This includes ensuring affordable services, reliable transportation option. We also need to kind of build local capacity and trust, invest in training local researchers and healthcare professionals, particularly from underrepresented community, to build trust and ensure research efforts are locally relevant and sustainable. And I think this is what I can share on that issue.
I like the fact that you brought up the aspect of criminalization, which ideally for certain populations, so it kind of limits research and makes the underrepresentation. It continues being a bigger problem that we have, and we are in a big year 2025, but unfortunately some of these things are still a reality in some of the societies that we live in. So thank you so much for bringing that up, especially with the current wave that we've seen in 2025, and even researchers being limited to the populations that they can research on. I truly appreciate that. We are about to get into our second last segment. And if you have a question, there's somebody who requested that they need to ask you guys questions directly, one-on-one. They want to voice out. Please raise your hand, and then we are going to give you the mic. But let me go to Professor Tumbi. And this ideally is technically the same question I asked Marcel, but it's more of the Eastern Southern Africa region. Which engagement models do you think are working well, and how can they be strengthened for cure research? I know you mentioned about CABs, community advisory boards, but how can we strengthen them better?
First of all, I do think that in East and Southern Africa,
Mm-hmm.
the youth are very engaged and very progressive. We've seen the Gen Z movements, raising various issues around politics, and I think this kind of engagement is what we need. We need people engaged, and people need to feel that the taxes that they pay are serving them.
Yeah.
In the same way, if there is a problem in society, like HIV is a problem, we need to take ownership of it, and we need to set the path. We need to say, this is a way to solve this problem. This problem needs to be solved. And so advocating for an HIV cure. So that's why, Doreen, I'm a big admirer of you because of the work that you've done in terms of engaging young people in the area of HIV and making sure that people are aware of what is going on, and that people are not sitting back and waiting, but rather they're actively taking part. So that kind of engagement in networks, groups of societies of people living with HIV, absolutely very vital. But I think it needs to go beyond that. Our engagement needs to go, for example, to government.
Yeah.
So how can we organize and start engaging governments, for example? What are the avenues that we can use to reach the people who are making decisions in the ministries of health, so that we get listened to, so that there is some money, because Africa is very rich, but we live poor. So what we need to do is to better organize to see how can we reach the people that make decisions, so that whether they're at the level of ministries of health, or whether they're at the levels of parliament, or whatever other bodies that make decisions. I think that's the area that we haven't fully been able to find a way to engage as much and influence as much. And I think we need to do that. At a local level, when you hear there's a cure study happening, please volunteer to be part of either as a participant, if you're a person living with HIV, or you could volunteer to be a member of a community advisory board. And then, of course, in a webinar like this one that we are having, there's a lot of information that is being disseminated that is very important for people living with HIV, that somebody living maybe in a rural area or in a far-flung town may not be able to get access to this information directly. So you can use this kind of information that we are sharing to share it with your own community in your own area of influence. So I think, in general, I feel that we need to be more active citizens, but also be very strategic in terms of not just making noise, but making noise to the people that matter. The people, by that I mean the people who make the decisions.
Yeah.
So that we are getting listened to and we are taken seriously. And they know that we are taking these issues seriously and we are watching them as they make the decision. So I think active citizenry is really, really important. As of course, but at our local levels, we also need to be involved. As I mentioned, volunteer in studies, be part of community advisory boards, be part of societies of people living with HIV. If you're a clinician, for example, and I know there might be some clinicians attending this, have you organized a session within the clinician society to talk about HIV cure and what we need to do? This kind of active engagement is what we really need. And I think there are seeds of this, particularly in Southern and East Africa. I see it, but not nearly enough. We need to do much more.
Yeah. Thank you so much for insisting that we must bring the political leaders. This is something that keeps coming up because sometimes people say we might be talking to ourselves, and the people with the money and the real power and the real influence, they don't know why we need a cure. In fact, to them, they're like, you guys have ARVs. Why do you need all of these things? So we really, really, really need to bring them on board. So I'm going to go to the last section where I'm going to give it 5 minutes because we have some Q&A. This is just the future and looking forward from now. I will start with Marcel. What scientific hurdles remain before a cure becomes achievable, and what gives you hope that progress will continue?
Yeah, thanks, Doreen. So just few words on that. The primary scientific hurdles in achieving a universal HIV cure is the latent virus as well. So Tommy said, talk long about that. We need to, go and retrieve the virus and then kill it. So this is one of the major hurdles. Another hurdle is also the biology of the HIV virus itself. I told you that the HIV has is divided into many different different traits. So we don't know, each might be different to maybe to cure response in relative to others. So this is also a major obstacle. So until now we don't have like a biomarker about a biomarker to in the field, and also here in this region, the community engagement is still very archaic. So we need to strengthen that. But in terms of hope, so despite the significant challenges, several factors provide hope that progress will continue. We have the proof of concept that we have developed. It's possible. So today we have proof that cure is possible. So there's hope. We have advances in technology. We have some cutting-edge tools like CRISP, whereby that we can use to manipulate our DNA, to edit our DNA. This is something also that brings hope in terms of like cure research. You also have the mRNA technology, which is also something very interesting that will be very, very useful in the future. And also, as Toby mentioned, we have some scientific understanding now about latency, about HIV reservoir, and now I think we can leverage that for another step to or to improve our various clinical trials. Thank you.
I have been speaking on mute. Thank you so much for highlighting that there is indeed hope, that there is indeed research being done, and we hope to get a cure in this lifetime. Am I pushing it? But in this lifetime, we hope to get a cure. Now, the next person is going to be Jessica. Jess, which global trends or emerging technologies are most likely to accelerate the path towards a cure?
I don't know that there are any global trends or global technologies. I think that the science that is being done in labs in Boston are the same, science that's being done in in Professor Thumbi and Professor Marcel's lab as well. And I think that that's really the point to take home is that I think if there is a global trend, it's really about collaboration, and that is really about what COVID has shown us is that we're, again, as Prof. Thumbi said, if we want to go far, we have to go together. And that means working in collaborations and sharing information and making sure that we go together. But the science that's being done in one is the same. And that's really important too.
Thank you so much. Elena, how can PLHIV communities remain informed and empowered without falling into false hope or misinformation?
All right. I think the major part is ensuring that there is those spaces that are inclusive and have open dialogues where communities can ask questions, express their fears, and also that point where we can also review the accurate information without judgments. So it is very essential that we simplify so that communities can remain engaged. But I think even taking into platforms, I would given like an example of the Malawi advocacy we've been doing, because we understand that the government plays a key part in terms of policies that govern our programs. We've been working a lot with the National AIDS Commission to ensure that they integrate cure into the different national platforms and the main national meetings. That way we know that we're going to stay informed. But then also, by the end of the day, the communities or civil society is working with people living with HIV. We started to also educate these communities so that the information is not only hanging at a national level, but it trickles down to community level and the community structures. And especially right now with the funding landscape, I think HIV cure discussions are very, very vital, that they need to be discussed, but with an understanding. Because already the misinformation, for example, when Lenacapavir came out, it was, oh, there is a cure, there's a cure. So making sure that there's also a platform that is consistent in sharing information around cure, and also just a reflection and also monitoring on how people are understanding the concept. Because when you're using social media or the media, you just disseminate information. At times you don't have a proper platform to get feedback. So having proper mechanism to understand what kind of knowledge the communities have. So those would be some of the ways that would help.
Thank you so much. And in that breath, I want to send a special shout out to the series of Jojo on YouTube, to Sekabo's podcast, to my own YouTube channel. I will go back there. I will go back. I have content I have not posted. So for continuing with disseminating information about a HIV cure, and we will talk about a HIV cure until we actually get cured. Last but not least, Professor Thumbi, looking ahead 5 to 10 years, what scientific milestones could transform the HIV cure?
I missed out on, I think the audio broke just towards the end there.
Okay. What scientific milestone could transform the HIV cure landscape?
You decided to ask me the tough one at the end, right? I mean, I think what would transform it obviously is if we had something that really truly does work over a long period of time. I do think that if we have something that can keep people off pay for 1 year, let's say, and do it, you know, so that you don't have many people. Let me put it this way: if we could have something that if you give to people living with HIV and ask them to stop taking antiretroviral therapy, and 80% of them are able to live for 1 year without the virus rebounding. I think that would be a breakthrough. It wouldn't be a cure because what we want to really is a cure to get completely rid of HIV. But we need something that to show that we can make a progress towards this. So obviously, and I'm very excited because there's a lot of technologies that are out there that might actually lead to a complete cure of people. So it's possible that will happen. But in the near future, what I would like to see is something that works for the vast majority of people for at least 1 year or 2 years, where people can stay without antiretroviral therapy and the virus does not, the majority of them, the virus does not rebound. So that would be really, really transformative. But I think that the other areas actually that we need to think about, because one of the problems in doing HIV cure research, for example, is the problem of having to monitor people on viral loads. Because what makes this research so difficult is that people have to go to the clinic to get their viral load measured every week because you don't know when the virus is going to rebound.
Yeah.
So we probably also, another transformative technology would be if we could have something that or somebody can measure their viral load at home. Or the way we track sometimes how many steps you have walked in a day using your watch. If we could have something that measures the viral load and tells you that if you now interrupt treatment because you're in a clinical trial, please don't try this at home. But if you're in a clinical trial, that your viral load, it monitors your viral load so that you don't have to go to the clinic every week to get it. I think it will make this kind of research much easier to do. So we need technologies like that. And I think all of those technologies would help us to move towards a goal, with the goal being ultimately to get rid of HIV completely, a classical cure. But I think before we get there, what I would like to see is those kinds of innovations where we can control the virus maybe for a year without the need of antiretroviral therapy, or something that helps us to monitor the viral load and makes this kind of research much easier and much more accessible to people.
Thank you so much, Prof. And we have 7 minutes. So Penzi's hand has been up for a while because he says he has burning questions for all of you. So Penzi, please unmute yourself and ask the questions. But what I'd like, and Lizzie's hand is also up. So let's start with Penzi. Yeah, let's start with Penzi. But there are so many questions in the Q&A. Yeah. Okay. Penzi, please unmute.
Okay. Thank you so much, Doreen. So my name is Penzi. I'm from Malawi, and I'm a peer supporter as well as a peer advocate, whereby I'm working with Malawi AIDS and I'm working with Macro, in fact, Lady Plus Malawi. So, okay, I'll just go straight to the questions. I have some questions for, I don't know if it's for anyone, but this is for Elena, Madam Elena. So, okay, my question is going to the community. Like you said, okay, how are you making sure that the HIV cure trials are ethical and safe for the volunteers, That's my first question. Like, how are you making sure that HIV cure trials are ethical and safe for the volunteers? And another question is, how are communities being involved in the cure research process? Like, how are they being involved? Another one on the community is like, what support is there for the trial participants? Actually, I'm done to the community, and now let me go to Mr. Marcel. Okay, Mr. Marcel, I have some questions for you. Okay, you being a lab officer, how do scientists measure whether a cure strategy is working or not? How do you work on that? Another question is, okay, there are some scenarios whereby HIV sometimes hides in the body, like whereby it's undetectable. So how do you target those hiding spots, like uh hiding viruses in the body? How do you detect those? Yeah, so I think those are some of the questions I had. Thank you very much.
Thank you, Penzi. Lizzie, and then now they can answer all the questions. Lizzie?
Thanks, Doreen, for that. Mine will be a little bit brief. I'm more concerned about the news we woke up to today in the morning, where um, the US is not going to commemorate World AIDS Day. And that literally kind of sends a huge red flag on the progress that we've been making towards eradication of HIV. My question is, if you put your research hat aside for a minute, we know we need funding and we have a big dent. We've seen discussions around the sunsetting of UNAIDS, and I know you've talked about what you foresee in the next 5, 10 years within the research bit. What would be that doomsday if things remain or go the way they're actually heading right now? Forget about the funding, and we're trying to mobilize as much domestic resource mobilization as we can get. But to be honest, we still would rely on a lot of not only funding, but also infrastructure from the global north. What kind of doomsday would you want us to prepare for? And I don't want you to be like the devil's advocate. We just need to be prepared for things that might happen, despite us trying to be very optimistic in the moment. Thanks, Doreen.
Thanks, Lizzie. Whew.
Can
Loaded.
can I? Okay, can I take both the community and this last Lizzie's question, which I think is really great,
Yeah.
but perhaps maybe I will reframe it. I am American. That's unfortunate. America is not doing what it. We're really acting out in a very unfortunate way, and we're putting a lot of people at harm. But what I will say is that when it comes to funding and advocacy, HIV is often thought about in a silo, but it is not. What Prof. Thumbi said about advancing technology that is a take home for understanding viruses, that could be disease agnostic. That goes beyond HIV. If you have a take home test where you can identify viral rebound for HIV, that it could be the same test that you could use to identify a different virus and not go to a doctor's office. Taking a smaller blood sample to do these kinds of tests that they're doing in Cure for pediatrics also helps in adults to take a smaller blood volume. HIV and cancer have so many overlaps. So to think that funding for HIV, while we see the world sunsetting and there is things that we need to worry about, we need to think about that broader connection that HIV and the immune system have to other disease areas that researchers on this call now are already thinking about. And the discoveries that they're making impact far beyond what just one disease can say. So I know that you were asking for a doomsday, but for me, I think that this is a chance to reframe for hope and to also think about how we can link HIV in this broader context. And maybe I will just say quickly on the ethics I have an ethics a master's, and my professors would hate me for saying this, but ethics is this sort of icky feeling that you have. And what I think we're doing, Penzi, to ensure that that icky feeling isn't there, that unsettling feeling in these trials, is connecting with community to ensure that we have the support system set up, to ensure that the right people are enrolled in those clinical trials, whether that be, people who are most suited for that intervention, or, could have that broader impact in the population, we're really working closely with communities to ensure that the questions that are clearly relevant are also the support systems that are in place there. So there are very strict ethical standards and regulations and real community involvement, excuse me, to make sure that those feelings of uncertainty are mitigated. And one being just in South Africa, within the trial that Prof. Thumbi ran, there was actually a partner support system, a partner notification plan put in place that was developed by social behavioral scientists. So this is really something that is really being thought about, a prep being rolled out in different clinical trials. So the idea of making it safe, because ultimately people living with HIV are ultimately healthy, other than the fact that they have this virus. So then how do we ensure that the risks are minimized and there is a support system there?
Yeah. Thank you so much. Do we go to Elena and then Marcel?
Okay, all right, thank you. Thank you very much, Penzi, for your question. And we're in the same cycle, so I'm glad to hear that. So, but first of all, I think it's about understanding that each and every research has to go through a very serious process of approval. So everything is considered in terms of the safety of the participants that are going to engage in. So it's the same similar case with Malawi. I think the only disconnect was between the researchers and the communities. But for each and every research, there's also a community advisory group that also makes sure it represents and also stays alert on the whole process, looking at especially on the safety aspect. And in Malawi, we just started discussion around HIV cure seriously last year. That's when we began. So actively been working with the National AIDS Commission, the Ministry of Health, through the Department of HIV and the civil society. So everybody could get engaged. And one of the things we're working towards is to create a sustainable platform. So we're working with the Civil Society Advocacy Forum, which Penzi you can also be part of, because I welcome civil societies as well as individual advocates so that we can continue to do this work. So that is also to say we're going to work around developing an HIV cure consortium. Whilst right now we're already integrating into that. So that's how best we're seeing for a start, we're going to engage the communities in terms of HIV advocacy. But since we're in the same Malawi and also in a similar program, the Ready Plus, I think we can also have extra, discussion around this. Yeah, let me stop there.
Thank you so much, Elena. Marcel.
Yeah. So thanks, Penzi, for your question. So you asked about how do we ensure that HIV cure is working or not? To me said it very, very clearly. Ultimately, like HIV vaccine, like any HIV drugs, is through clinical trial. It's only we perform a clinical trial that we know that a cure strategy is working. But before getting that, we need to gather some evidence from the lab. And one of this evidence, and this also goes with your second question, is how to reverse the latency. HIV hide, as you mentioned, HIV hide in a set that they infect in a form of latency. So one of the strategies now is the shock and kill strategy. It's like to reverse the latency, to make the virus getting out of the cell and kill them. So there's some also good evidence that this can also work. And then from there we go into a trial, clinical trial, to really assess whether this can achieve a cure. Then this is the only way that we can assess that a cure is working or not is through a clinical trial. But before getting there, we need to to accumulate some scientific evidence. Thank you.
Ooh, we are 4 minutes over time, and there is a lot of questions that have not been answered. But I want to say thank you to everybody who joined. Thank you for the questions. Thank you for the engagement. This is just the first conversation, the first series of the many conversations we're going to have. Some of them are going to be on Instagram Live, on Twitter, on TikTok. We want the communities to be involved, to know what the HIV cure means for us. That means we're going to be speaking about pediatric HIV cure, HIV cure for adolescent girls and young women, for key populations, for men. Like, we will definitely be having these conversations going forward here at GNP Plus, and we will be definitely collaborating with most of you who have joined us today. So this recording is going to be shared as well. And I am so sorry that we did not get to answer all of your questions. But as you can see, Tumbi, Marcel, Jess, Elena, there are so many questions around the HIV cure. The community is ready to learn. The community is ready to be ambassadors of a cure out there. And we are very appreciative that you took your time and showed up for us today. So we truly, truly appreciate it. So from me, I want to close this webinar officially and thank everybody for joining us. And please follow our social media platforms, GNP Plus, everywhere. We are definitely going to come back with another cure conversation, but this is probably going to be very population based, and maybe we will start with the children. So Jessica, we will come back again on the pediatric chat and you'll tell us what is happening around there. So Professor Tumbi, thank you so much for taking time. Marcel, thank you so much and continue doing the good work you're doing. Elena, thank you so much for the work you're doing in Malawi. I am also pushing that they add the HIV cure conversation in our treatment guidelines. So thank you so much. And thank you so much, Jessica, for all the support and for joining us today. From me and from the GNP Plus team, we want to say asanteni sana and see you next time.
Bye.
Bye-bye.